Welcome to San Diego's most popular local morning news. Good morning, San Diego.
Botox, it is a treatment that can cost big bucks for some. Well, now one local doctor is using an alternative to the popular wrinkle injection. We'll take you out to La Jolla to find out all about this new treatment. Welcome back. If you're one of the millions who receive Botox treatments, you know how much the procedure can cost and the inconvenience that it can cause. But this morning, we are showing you an alternative to Botox. Lene Lewis is live in La Jolla with more.
Made them jump through the hoops, and it's been used for reconstructive purposes for people with a disease called torticollis and people with blepharospasm for quite some time as well. But for cosmetic uses, it just received its approval.
And you were saying one of the benefits to this as well is that now Botox is going to have a little competition here in the United States.
Yeah, absolutely. I think that's always a good thing. They've sort of had the market to themselves, and as a consequence, many patients express to us, they're like, why is this stuff so expensive? And what they don't realize is most of it's not going to the provider. Most of it's going to the manufacturer. So what this will do, right now it's come out at a lower price point, which is nice for patients. It's 10 to 20% less expensive. And of course, we're passing that along to patients as well. But in addition, I think over time might drive the price of Botox down once they realize that they're not the only, you know.
Well, 20% certainly is significant savings. I'll let you continue on with what you're doing here.
And that 20% adds up when you're doing one area, it's nice, and when you're doing more than one area, it definitely starts to add up. Okay. Again, and plus the fact that it lasts, a month or two longer, at least potentially, according to the FDA studies, is pretty significant as well.
Yeah, that's the information that we're showing our viewers right now as we're talking about it, that it does last a little bit longer, you see results faster, and it is less expensive.
Exactly, and it seems to spread more evenly, which again has its good points and bad points. It has to be done by a qualified provider who knows what they're doing to make sure it doesn't spread. It weakens muscles. Botulinum toxin type A weakens muscles, and you put it into the right muscles and you get the effect you want, and you put it into the wrong muscles and you're not so happy. So it needs to be done properly, but done properly, it's really straightforward. And again, this tends to go in a little more evenly, a little more smoothly than Botox, which, again, you have to be careful or it can look a little spotty. We've all seen those people where their forehead's frozen in one area and still moving in another. It doesn't look so good.
Well, Dr. Miller, thank you so much for telling us about this new product. We're going to let you continue on with what you need to do here. And Lori, thank you for being a good sport for us as well. We appreciate it. So, Sandra, that's the good news for those out there who have been using Botox. Now there's another choice out there on the market. And certainly, as Dr. Miller told us, that he believes it will add some competition and give patients a choice as well.
Well, competition is good for consumers, that's for sure, Lene.
That's right. Competition is always good.
Thanks so much for the update.